Today, I'm extremely pleased to be here with Minister Darcy to announce a new agreement between the Government of Canada and British Columbia. Under this agreement, our government will provide a total of $71.7 million to improve access to treatment services for people with problematic substance use in British Columbia.
Today will make a life-saving difference in the lives of British Columbians, and it will help connect more people to treatment and recovery services. And you know, our successes are Canada's successes. We know the overdose crisis is affecting people right across this country. British Columbia has been ground zero for the overdose crisis. We have led the way in the number of deaths. 4 people a day, 1,450 last year. But we also believe it's fair to say we've led the way with the boldness and the innovation of our response. And we will continue to share the lessons that we've learned with our provincial and federal partners in the interest of helping more Canadians find a pathway to healing and hope.
The province of Ontario is currently doing a review of safe injection sites. Will you wait until that review is done before you start talking to the province of Ontario? And does that type of review concern you in terms of potentially them going against the evidence and finding it?
Well, we've made it very clear that if the province of Ontario is looking for any data with respect to the effectiveness of supervised consumption sites, we are absolutely pleased to provide them with all of the data that we have. And also my colleagues provincially have indicated that they would do the same thing. We know that safe consumption sites save lives at the end of the day. We absolutely want to make sure that Canadians have access to treatment on the ground. It could be for overdose prevention sites, but in actual fact, provinces and territories can decide in which investments are going to be made with respect to addressing these issues on the ground. So I look forward to having that conversation with Minister Elliott and her officials as we move forward with the negotiations.
I just want to speak to the issue of evidence. We have nearly doubled the number of overdose prevention sites and safe consumption sites in British Columbia in the last year. We have had, and the evidence is clear, we have had 856,000 visits to these overdose prevention sites. Nearly 2,000 overdoses have been reversed and not a single life has been lost. So the evidence is there. We certainly look forward to sharing that with the province of Ontario and with anyone, anywhere. Harm reduction works, overdose prevention sites work in order to save lives.